When you come in with hip problems, usually there's concerns that there's pain in the hip, you're not walking well, the hip is giving out. In that case, we would check you over, make sure that it's not just something superficial like just a muscle type injury or a contusion. And then we'd get x-rays. If the x-rays actually show that the bone is touching the bone and it looks like the cartilage is gone, in other words, you normally have a little joint space above the hip. If that's gone, then you're getting arthritis and probably need a total hip replacement. Your hip is normally a ball and socket like this. This is what we do to resurface that ball and socket. So now you have a new ball and socket, but it's metal and plastic. And you can see it does all the range of motion your hip would normally do. You usually put these in with what they call non-cemented components. What we do is pound this in with very close tolerances, so the bottom line is the bone grows into that socket. Same thing with this. We pound this down the femur bone. Bone is hollow, so this can actually fit down if you machine it right so it fits, and the bone grows into that prosthesis. So now you have a new hip joint. It usually takes several weeks to get to the point where the bone is growing in. Usually we keep you on a walker or crutches for a short period of time to make sure that that bone grows in, and after it does, then you have a nice hip. There are some restrictions after hip surgery. We don't want you flexing it too much so you don't pop it out of the socket like that. We don't want you doing that. We don't want you, doing anything strenuous for a while, but after this starts to heal in, then it's like a normal hip joint. You do what you do on a regular basis. And you can see the muscles will make this move, and it's a very solid socket when it's pulled together and there's scar tissue around it. It's not going anywhere unless you do something like falling. Unfortunately, we don't want anybody falling after their total hip replacement. There are risks: infection, stiffness of the hip. You can pop it out, but these are the basic things you have. And you will be on a walker for a couple weeks after the surgery, gradually progressing your activity and formal physical therapy. But you can see this is the artificial joint that we would put in your hip.